What if I told you that the most dangerous moment for your heart isn't during the day? It's at night, while you're lying in bed believing you're perfectly safe. What if I told you that the blood pressure reading your doctor checks at your annual appointment is telling you only half the story? And the half that nobody's watching, the half that happens while you sleep, is quietly destroying your arteries, your kidneys, and your brain one night at a time? I need you to hear something right now. Something absolutely critical that most people living with high blood pressure have never been told. Your blood pressure is biologically designed to drop 10 to 20% every single night while you sleep. It has a name. It's called nocturnal dipping. And when that drop doesn't happen, when your blood pressure holds steady or even climbs throughout the night, your cardiovascular risk doesn't increase slightly. It doubles. In some cases, it triples. And here's the part that genuinely shakes me after 23 years in cardiology. The vast majority of seniors have absolutely no idea this is happening inside their bodies. They check their pressure in the morning, they get a reading that doesn't alarm them, they feel reassured, and they go about their day, completely unaware that while they were sleeping, their blood vessels were under sustained, relentless siege. But here's what I discovered over more than 2 decades of treating heart patients. There are specific, evidence-based things you can do in the 90 minutes before you go to bed, things that cost nothing and require no prescription, that trigger your nocturnal dip, that activate your body's own built-in pressure-lowering systems, that cause your blood pressure to fall exactly the way it was biologically designed to fall every single night. And some of these things take less than 5 minutes. I'm Dr. Sandra Whitmore, and what I'm about to share with you tonight is going to permanently change how you think about blood pressure management. Before we begin, if this information sounds valuable to you, please subscribe to this channel right now. This content could genuinely save your life. Let me tell you about Robert first, because Robert's story is going to show you exactly what's possible with this bedtime protocol before I even reveal what it contains. Robert was 71 years old, a retired firefighter from Ohio, and he had been battling high blood pressure for 9 consecutive years. He was on 2 medications. His cardiologist was actively discussing adding a third. His morning readings hovered stubbornly around 158/96. Not a crisis, but persistent, immovable, immune to everything they threw at it. He exercised 3 times a week. He'd reduced his sodium. He'd eliminated alcohol entirely. And still, the numbers wouldn't budge. When Robert came to my practice, I made an unusual decision. I didn't change his diet. I didn't touch his medications. Instead, I asked him a single question that he'd clearly never been asked before. "Robert," I said, "walk me through exactly what you do during the 2 hours before you go to sleep." He paused. He watched television, he said, sometimes scrolled through his phone, maybe had a small snack. Then he went to bed around 10 p.m. That was it. I told him I was going to give him a protocol, 7 specific things to do in the 90 minutes before sleeping each night. Each one grounded in real cardiovascular physiology, not folk medicine, not wishful thinking. His only job was to follow it exactly for 2 weeks and then report back. 2 weeks later, Robert sat across from me with his blood pressure log in hand. His morning readings had averaged 131/82 for the entire 2nd week, 27 points lower than when he walked in. Without changing a single medication, he said, I don't understand what happened. I told him his body finally got the chance to do what it had been trying to do all along. Before I show you what Robert did, before I reveal those 7 techniques, I need to explain something about blood pressure physiology that changes the entire picture. Something that most doctors never take the time to explain, but that is absolutely fundamental to understanding why these bedtime techniques work. Most people with high blood pressure think of it as a fixed problem, either controlled or uncontrolled. Either your medications are managing it or they're not. But blood pressure is not a fixed number. It's a dynamic, constantly fluctuating biological measurement that responds to signals from your nervous system, your hormones, your emotional state, your body temperature, what you ate, what you've been staring at, and dozens of other variables, all in real time. And your body has a specific built-in mechanism designed to use the nighttime hours to lower and repair. During healthy sleep, your sympathetic nervous system, the one responsible for driving fight or flight stress responses, gradually goes quiet. Your parasympathetic nervous system, the one that governs rest, repair, and recovery, takes over. Cortisol drops significantly. Adrenaline clears from your blood. Your heart rate slows. Your blood vessels relax from the inside out. Blood pressure naturally begins its descent. This is the nocturnal dip. And researchers have confirmed that the size of that dip is one of the single most powerful predictors of long-term cardiovascular outcomes. People who dip normally, whose pressure drops 10 to 20% overnight, have dramatically lower rates of heart attack, stroke, kidney failure, and cognitive decline. People who don't dip, what cardiologists call non-dippers, carry 2 to 3 times the cardiovascular risk of those who do. Now here's the question that matters. What prevents the dip from happening? Stress hormones that haven't cleared from the day. A sympathetic nervous system that's still activated. Blood vessels still partially constricted. Magnesium deficiency making vessel walls unable to relax. Poor sleep architecture preventing the deepest restorative sleep stages. And specific evening habits you might be engaging in right now without any awareness that they're blocking your body's most important nightly repair process. Every single one of the 7 techniques I'm about to show you works by removing one of those blockers. By creating the conditions for your body's natural nocturnal dip to happen fully, powerfully, and every single night. When all 7 work together, the combined effect can be profound. Let me show you. Let me begin with technique 7, and I want to acknowledge something before I explain it. This is the one most people dismiss immediately. It sounds too simple. It sounds like something your grandchild tells you to do. But wait until I explain the actual mechanism at work, because the biology here is something that will change what you do tonight. Technique 7 is the screen blackout. No television, no phone, no tablet, and no computer screen for at least 60 minutes before bed. Let me tell you about Dorothy. Dorothy was 69, a retired librarian from Vermont. She was diligent, disciplined, careful about her health in almost every way. But every single night, she'd prop herself up against her headboard with her tablet and watch streaming shows or scroll through online news until her eyes got heavy, usually somewhere around 10:30. She genuinely believed she was winding down. She thought the familiar routine was helping her transition to sleep peacefully. But her morning blood pressure readings were consistently averaging 162/94. I asked her to try just one change, nothing else. No screens after 9 p.m. for 2 weeks. After 14 days, her readings averaged 149/87, 13 points down from one behavioral change. Here's what was happening inside Dorothy's nervous system every single night without her knowing. When your eyes receive the blue spectrum light that screens emit, your brain does something automatic and powerful. It interprets that light as sunlight, as evidence that it's still daytime. In direct response, your brain suppresses melatonin production. Now, most people know melatonin affects sleep, but what almost no one realizes is that melatonin also plays a direct role in regulating blood vessel tone and facilitating nighttime blood pressure reduction. When you suppress it with screen light, you suppress that relaxation signal in your arteries. But there's a second, equally damaging process happening. The content on those screens is activating your emotional and stress response centers. News stories, social media arguments, dramatic television programs. Every bit of it is triggering small cortisol releases, tiny adrenaline pulses, low-level sympathetic nervous system activation at precisely the moment when your cardiovascular system needs to be stepping back from all of that. Dorothy wasn't just disrupting her sleep. She was keeping her blood vessels on high alert through the entire period when they were biologically designed to be recovering. The screen blackout is non-negotiable, 60 minutes minimum. Fill that time with quiet reading, gentle stretching, or the other techniques in this protocol. Now let me show you technique 6. And this one is going to make you rethink your evening kitchen habits. Because there is a very good chance that something in your late night routine is quietly undermining your blood pressure overnight without a single obvious warning sign. Technique 6 is what I call the potassium evening exchange. Consciously replacing any high-sodium evening snack with a potassium-rich one. Let me tell you about Walter. Walter was 73, a retired contractor, and he was doing a genuinely good job managing his sodium. He'd cut out the salty lunch foods, reduced his sodium at breakfast, read labels carefully during the day. but his morning blood pressure readings still averaged around 155/90. I did a thorough dietary review with him, going through everything he consumed across a full day, and I found the issue hiding in the evening. Every night around 9 p.m., Walter had the same snack, a handful of salted crackers with processed cheese spread. Not a large amount, barely 200 calories, but both items were high in sodium, and he was consuming them roughly 2 hours before going to sleep and then lying horizontal for 8 hours while his kidneys were in their slowest overnight processing state. Here's the physiology, and this is the part that most people have never considered. Sodium causes your kidneys to retain water. That retained fluid increases the volume of blood circulating in your vessels. Higher volume means higher pressure. Normally, throughout an active day, your kidneys can process and excrete excess sodium reasonably efficiently. But during the overnight hours, kidney filtration rate slows significantly. If you've consumed sodium late in the evening, it doesn't clear. It accumulates. It drives blood pressure upward through precisely the hours when that pressure should be falling. Potassium works in direct biochemical opposition to sodium. It activates sodium-potassium pumps in your kidney cells, actively pulling sodium out of your bloodstream and into your urine. It relaxes the smooth muscle walls of your blood vessels directly. It counteracts sodium's pressor effects at the cellular level. Studies examining potassium intake and blood pressure have consistently shown reductions of 4 to 8 points systolic when potassium intake increases, and the evening timing amplifies that benefit. A banana, a small avocado, a handful of dried apricots, or a small serving of plain yogurt gives your kidneys the tools to clear overnight sodium during the very window that matters most. We switched Walter's evening snack. Within 2 weeks, his morning readings had dropped 9 points. Let me introduce you to Technique 5. And I need to tell you that this is the one that generates the most skepticism in my practice because when I mention it, the reaction is almost always the same. People look at me like I've stepped outside the bounds of serious medicine and wandered into herbal folklore until I show them the research, and then the skepticism disappears very quickly. Technique 5 is drinking 1 cup of hibiscus tea made from dried hibiscus flowers approximately 90 minutes before bed. Let me tell you about Evelyn. Evelyn was 67, a former high school science teacher who regarded anecdotal health advice with visible suspicion. She had a rule. She didn't adopt any health practice without peer-reviewed evidence. When I suggested hibiscus tea, she looked at me with what I can only describe as restrained professional disappointment. But her blood pressure was stubbornly sitting at 148/90, and she was unwilling to add a second medication to her regimen, so she agreed to look at the research herself, and then she agreed to try it. 6 weeks later, she walked into my office, placed a printed log on my desk, and said, "I need a full explanation, because this doesn't make sense to me biochemically." Her average morning readings had dropped from 148/90 to 138/83, 10 points systolic, over 6 weeks, from tea. Here's the biochemistry, because Evelyn deserved it and so do you. Hibiscus contains a class of compounds called anthocyanins, along with various organic acids including hibiscic acid. These compounds have been shown to inhibit an enzyme in your body called angiotensin-converting enzyme. If that sounds familiar, it should. ACE inhibitors are one of the most widely prescribed classes of blood pressure medication in the world. Your doctor may even have you on one right now. The reason they work is that they block the production of angiotensin II, one of the most potent blood vessel constricting molecules in human physiology. When angiotensin II production is blocked or reduced, blood vessels relax, peripheral resistance falls, blood pressure drops. Multiple rigorous clinical trials involving subjects with stage 1 hypertension have confirmed that consistent hibiscus consumption can lower systolic blood pressure by 6 to 10 points, a result that is clinically meaningful for any cardiologist. The reason I recommend it 90 minutes before bed specifically, rather than at another time of day, is timing. You want those active compounds circulating and exerting their vasodilatory effect during the precise window when your body is attempting to initiate its nocturnal dip. You're giving the process pharmacological-grade support using a cup of tea. Use dried flowers, not tea bags when possible. Steep for 5 minutes. Do not add sugar or sweeteners, as the glycemic response works against the benefit. Drink it warm while you begin your wind down. Technique 4 is the one that addresses something we talk about constantly in blood pressure medicine, but almost never address properly: stress. We say stress raises blood pressure. We say to reduce stress. But nobody explains the actual physiological mechanism with enough precision to make the advice actionable. Let me do that now, and let me do it through Raymond's story, because Raymond's story is one of the most instructive ones I have. Raymond was 72, a retired corporate attorney, genuinely one of the sharpest people I've ever treated. He never fully stopped working mentally, even in retirement. He consulted, he mentored, he served on committees. And every single night, he had a ritual he was almost proud of. Before falling asleep, he'd lie in the dark and run a systematic mental review of the day. What decisions had been made, what conversations had happened, what tasks were pending, what problems needed solutions tomorrow. He thought of it as responsible preparation. His blood pressure told a different story. His morning readings were chronically in the 152 to 158 range despite being on medication. Here's what Raymond couldn't see from the inside. Every thought about an unresolved problem, every mental note about tomorrow's meeting, every replay of a difficult conversation, every item on the mental to-do list activates the stress response circuit in your brain. A small cortisol pulse, a minor adrenaline tick, the barest contraction in your blood vessel walls. Individually, each of these responses is tiny. But Raymond was running this process for 40 to 50 minutes every single night, right through the window when his parasympathetic system was supposed to be taking over. His nocturnal dip wasn't happening because his sympathetic nervous system was receiving continuous low-level activation signals right through the most critical cardiovascular recovery window of the day. Technique 4 is progressive muscle relaxation, and it is one of the most evidence-backed, physiologically precise tools available for forcing the sympathetic to parasympathetic transition. The practice is straightforward. Starting with your feet, you deliberately tense one muscle group as firmly as you can for 5 seconds, then release it completely. You move up systematically: calves, thighs, glutes, abdomen, chest, hands, forearms, shoulders, neck, face. Each release sends a powerful contrast signal to your nervous system, the shift from contraction to release. Your brain registers this contrast as a bodily cue for safety, for deactivation. Within 10 to 12 minutes, heart rate slows, cortisol begins dropping, and blood vessels begin their relaxation sequence. Published clinical data shows that consistent progressive muscle relaxation reduces systolic blood pressure by 5 to 8 points and measurably improves nocturnal dipping patterns. Raymond replaced his mental review sessions with this 12-minute practice. His morning readings fell by 11 points within 3 weeks. He also told me, for the first time in probably 20 years, he was waking up feeling genuinely rested. Now let me show you technique 3. I want to be transparent with you. When I first began prescribing this to patients, some of them looked at me as though I had miscalculated their copayment and was now trying to distract them. Because technique 3 is something that feels too pleasant, too self-indulgent to be a medical intervention. But the physiology is airtight, and the results are repeatable. Technique 3 is a warm shower or bath lasting 15 to 20 minutes, taken approximately 60 minutes before going to bed. Let me tell you about Grace. Grace was 74, practical, efficient, not a person who spent time on activities she didn't consider necessary. She was in and out of the shower in under 4 minutes every evening. Nothing wrong with that, in terms of hygiene. But her blood pressure was persistently elevated in the 155 to 160 range in the mornings. Despite a genuinely healthy overall lifestyle, I asked her to change one thing, just one. A 15-minute warm shower. Not hot, not cold, specifically warm, somewhere between 98 and 104 degrees Fahrenheit, taken around 1 hour before her bedtime. She tried it for 10 days, mostly out of a willingness to humor me. After those 10 days, her morning readings had dropped to 141/84. She came back a little less skeptical about physicians' strange ideas. Here's the mechanism, and this is one of my favorite pieces of cardiovascular physiology because it demonstrates beautifully how interconnected our body's systems truly are. When your skin is exposed to warm water, your peripheral blood vessels, the ones close to your skin's surface, dilate dramatically. Blood is actively pulled toward the surface, away from your core organs and your major vessels. This process, called peripheral vasodilation, directly reduces systemic vascular resistance. Your heart is now pumping against a relaxed, open vascular bed rather than constricted vessels. Blood pressure falls. That's the first mechanism, but there's a second one that is specifically brilliant for bedtime use. When you step out of the warm water after 15 minutes, your core body temperature, which was elevated during the bath, begins dropping. And that drop in core temperature is one of the primary biological signals that initiates deep sleep. Sleep research has confirmed consistently that the transition from elevated to falling core temperature is what triggers your body's entry into the deepest, most restorative sleep stages, the non-REM stages, where the most significant nocturnal blood pressure dipping occurs. So the warm water protocol does two things simultaneously and powerfully: immediate vasodilation that lowers pressure now, and the triggering of deep sleep architecture that maintains pressure reduction through the entire night. The 1-hour timing is specific, not arbitrary. You need that window between stepping out of the shower and lying down for the core temperature drop to occur and the deep sleep signal to be transmitted. Grace now says that evening shower is her favorite moment of the day, and she says her numbers prove it. Before I show you techniques 2 and 1, the two most powerful techniques in this entire protocol, I want to pause for just a moment. If what you're hearing right now is giving you tools you've never had before, if you're realizing that the bedtime hours are the most important cardiovascular hours of your day, please subscribe to this channel and share this video with anyone in your life managing blood pressure. What comes next is the most important part of this entire video. Don't leave before it. Technique 2. And, I'll be candid with you. This is the one I wish had been taught in medical school with the emphasis it deserves. Not because it was absent from our training, but because its clinical significance for blood pressure was dramatically minimized. We were taught to think about magnesium primarily in the context of heart rhythm emergencies. What we were not taught, what I had to discover through years of practice and research, was how profoundly magnesium deficiency contributes to chronically elevated blood pressure, and how dramatically correcting that deficiency can move the numbers. Technique 2 is taking magnesium glycinate before bed, 300 to 400 milligrams, taken 60 to 90 minutes before sleep. Let me tell you about Herbert. Herbert was 69, a retired pharmacist. He had more knowledge of drug mechanisms than most physicians I've worked with, which meant he was both an excellent patient and an extremely challenging one. When I suggested magnesium supplementation, he gave me a polite but unmistakable smile that said he considered it a placebo-tier intervention. He'd been on blood pressure medications for 6 years. His readings were around 142/88, controlled but persistently hovering above the optimal threshold. We'd tried adjusting his medications multiple times. Nothing moved him below 135. He agreed to research magnesium independently before deciding. A month later, he called me. His voice had that specific quality that people use when they're surprised to be admitting they were wrong about something. He'd been taking 400 milligrams of magnesium glycinate every night for 3 weeks. His morning readings were now consistently averaging 129/79. He'd reviewed 4 separate meta-analyses while doing his research. "The evidence is stronger than I gave it credit for," he said. "Here's the biochemistry that changed Herbert's mind, and that I want to share with you now." Magnesium is required for more than 300 enzymatic processes in the human body, but 2 of its functions are particularly critical for blood pressure regulation. First, magnesium is an essential cofactor for the relaxation of smooth muscle cells that line your blood vessel walls. Those smooth muscle cells have 2 states: contracted, which narrows the vessel and raises resistance, or relaxed, which widens the vessel and lowers resistance. Without adequate magnesium, those cells cannot fully relax. The vessel walls remain in a state of partial, chronic contraction. This is not a dramatic effect you notice. It's subtle, constant, and it accumulates. Correct the magnesium deficiency, and those vessels relax, resistance falls, and blood pressure drops. Second, magnesium functions as a natural calcium channel blocker. Calcium ions entering smooth muscle cells drive contraction. Magnesium competes for the same entry points and blocks calcium from entering. This is the identical mechanism used by an entire class of prescription antihypertensive medications called calcium channel blockers. The difference is that magnesium does it gently, physiologically, without the side effects that pharmaceutical calcium blockers often carry. Multiple pooled analyses involving thousands of participants have confirmed that magnesium supplementation can lower systolic blood pressure by 5 to 6 points on average, with some individuals, particularly those who were most deficient, seeing drops of 12 to 15 points. The reason I specifically recommend the glycinate form matters. Magnesium glycinate is magnesium bound to the amino acid glycine. Glycine independently activates inhibitory receptors in your central nervous system that reduce neural excitation, promote calm, and facilitate sleep. You're receiving vascular relaxation and nervous system calming from a single compound. Taken before bed, the vasodilatory peak aligns with your nocturnal dipping window. Herbert keeps a printed research abstract in his wallet now. He shows it to other patients in my waiting room when he comes in for follow-ups. And now we've arrived at Technique 1. The single most powerful technique in this entire protocol, the one that can lower blood pressure by 8 to 12 points on its own, the one that requires no purchase, no preparation, no equipment, and no prescription of any kind. Just your lungs, your diaphragm, and 5 minutes. Before I reveal it, I need to give you the context that makes it extraordinary. Every other technique I've shown you today works through an external mechanism. You're changing an environment, consuming a substance, modifying a behavior. Those approaches are all genuinely effective, but Technique 1 is different in nature. It works from the inside. It accesses a physiological pathway that your body has been waiting for permission to use, a pathway that bypasses your sympathetic nervous system entirely and activates your parasympathetic system on direct, deliberate command. No other intervention does this as immediately and as measurably. And I want to tell you about Frank before I demonstrate it, because Frank's story is the most dramatic outcome I've witnessed in this entire area of my practice. Frank was 75, a retired career military officer. He had the kind of constitutionally precise discipline that made him outstanding at following protocols once he accepted their validity. But his threshold for acceptance was high. He needed evidence before commitment. His blood pressure was genuinely dangerous. He was on 3 separate antihypertensive medications. His morning readings still ran around 160/98. He had been hospitalized once for a hypertensive urgency event, blood pressure so high it required emergency intervention. He was frightened, and honestly, he was exhausted from being frightened. He came to my office after reading about research on the relationship between controlled breathing and blood pressure.